This is a presentation to inform you, the referral source or caregiver of a Medicare beneficiary, of the changes in policy in the way you would order durable medical equipment beginning January 1st, 2011. CMS or Medicare has instituted competitive bidding for durable medical equipment, which means that a durable medical equipment supplier had to bid with CMS and win and accept the bid to now be able to provide durable medical equipment to the patient in certain areas of the country. What is competitive bidding? As of January 1st, 2011, all referral sources and consumers will be required to use a Medicare contract supplier if the patient needs a product from the list of 9 product categories and resides in one of the 9 competitive bid areas, which we will cover in this presentation. Who is a Medicare contract supplier? A Medicare contract supplier successfully bid and accepted a contract from CMS to supply certain durable medical products at a set low bid price in one of the 9 CBAs or competitive bid areas. Who does it affect and when? Competitive bidding will affect Medicare patients in the following 9 competitive bid areas. They are the Cleveland, Elyria, Mentor, Ohio area, Charlotte, Gastonia, Concord areas in North Carolina and South Carolina, the Cincinnati and Middleton areas in Ohio, Kentucky, and Indiana, Dallas, Fort Worth, Arlington in Texas, Kansas City in Missouri and Kansas, Miami, Fort Lauderdale, Pompano Beach in Florida, the Orlando and Kissimmee area of Florida, Pittsburgh, Pennsylvania, and the Riverside, San Bernardino, Ontario areas in California. This includes all or part of these cities. For a list of counties and zip codes included in the competitive bidding program, go to our website at www.medicaresuppliersnetwork.com. Products included in competitive bidding are oxygen supplies and equipment, standard tower wheelchairs, scooters, and related accessories, complex rehab tower wheelchairs and related accessories. These are the Group 2 complex rehab chairs only. Enteral nutrients, equipment, and supplies. Mail order diabetic supplies. This does not affect buying product in the store for your diabetic supplies. CPAP devices, respiratory assist devices, and related accessories and supplies. Hospital beds and related accessories. Walkers and related accessories. Support services. These are the Group 2 mattresses and overlays in the Miami competitive bid area only. This does not affect any other competitive bid area or the Group 1 mattresses and overlays. For more details on the products included in competitive bidding, please visit our website at www.medicaresuppliersnetwork.com. Some of the frequently asked questions about the competitive bidding program are listed as below. The first one is, do I have to get new supplies and equipment that the patient needs from a contract supplier? Beginning on January 1st of 2011, you generally must order the equipment from a Medicare contract supplier, unless the supplier you are currently using is exempt, or otherwise known as grandfathering. We will discuss the exemptions or grandfathering on the next slide. What is a grandfathered supplier? A grandfathered supplier is a non-contract supplier that elects to continue to furnish certain rented items to a person with Medicare to whom they were currently providing these items prior to the beginning of the competitive bidding program, which is January 1 of 2011. This applies only to certain equipment that can be rented, such as CPAP devices, oxygen and oxygen supplies, enteral equipment, and beds. Enteral nutrients or food, diabetic supplies, and items that are not rented cannot be grandfathered. The patient can only continue to rent items from a grandfathered non-contract supplier that the patient started renting from before January 1st of 2011. The patient cannot start rental of an item included in this program from that non-contract supplier after January 1st, 2011 and have it covered by Medicare. How will you know if the durable medical equipment company you are currently using is a contract supplier? Medicare will begin informing the public of the list of winning suppliers in October of 2010. The durable medical equipment company should also be informing you as soon as the names are released by Medicare in September of 2010. Keep in mind that could be the very last of the month or even the 1st of October. For more information as it is updated from CMS, you could go to www.medicaresuppliersnetwork.com, and that information will be updated as released by CMS. If a patient is currently using a supplier who did not bid or did not win or accept a bid, does the patient have to change suppliers? Yes, unless their supplier is a grandfathered supplier. If you have further questions on that after reviewing these slides, please email us at info@medicaresuppliersnetwork.com for additional questions or clarification about grandfathering. Does it matter what doctor the patient uses? No, this does not affect the physician that the patient uses. Does it affect a patient who is in a Medicare Advantage plan? Competitive bidding applies to original Medicare. If the patient is in a Medicare Advantage plan, the plan should notify the patient if their supplier is changing. The patient should contact their plan if they have any questions. What determines if a patient is affected by competitive bidding? It will depend solely on the zip code of where the patient lives. Does competitive bidding affect who repairs equipment for a patient? If the patient needs a repair only and they own the equipment, the repair can be performed by any Medicare-enrolled supplier, whether they are contract or not. In these cases, it is up to the individual supplier whether or not they will accept payment from Medicare for the repairs or if the patient will be responsible for the payment. If the patient needs repair and replacement parts to make the equipment serviceable, and the replacement part is part of the product category covered in competitive bidding, they can get the part from a contract supplier or non-contracted supplier. In these cases, it is up to the individual supplier whether or not they will accept payment from Medicare for the repairs or if the patient will be responsible for the payment. If the patient needs a replacement only of a piece of equipment, they have to get the equipment from a contract supplier. This includes the equipment and/or parts and accessories for the base equipment that are being replaced, as well as other parts that have to be replaced since the base equipment is being changed. If the patient is visiting a CVA and needs a replacement, but the patient does not normally live in a competitive bid area, they must get the replacement from a contract supplier while visiting the CVA. If you have a patient who travels to one of the 9 competitive bid areas and needs medical equipment or supplies that are included in the competitive bid program, there are many scenarios which come into play as indicated in this table. The first scenario is if your patient is in a CVA, such as Dallas, Texas, and travels to an area in competitive bidding, such as Miami, Florida, they must get their equipment from a Medicare contract supplier in the competitive bidding program. In scenario 2, if the patient lives in Dallas, Texas, which is in the competitive bid program, but travels to Little Rock, Arkansas, which is not in the program, they can get their equipment from any Medicare-enrolled supplier while in Little Rock. In scenario 3, if the patient lives in Little Rock, which is not in the program, but travels to Dallas, Texas, which is in the competitive bid program, they must get their equipment from a Medicare contract supplier. And lastly, in the scenario 4, is if the patient lives in Little Rock, which is not in the program, and travels to Lincoln, Nebraska, also not in the program, the patient can get their equipment from any Medicare-enrolled supplier. What is the Medicare Suppliers Network? This slideshow is being presented to you by the Medicare Suppliers Network. We are a network of durable medical equipment suppliers who have accepted bids from Medicare and want you to know what is happening and how things will change on January 1st of 2011. We're in the process of creating a website which will be easy for you to use going forward in locating a Medicare contract supplier. This website is currently being built, but at this time, information on the site of www.medicaresuppliersnetwork.com does contain the information provided in this presentation. Please feel free to go to the website for more information. As more information is released by CMS, we will be updating and releasing more information to the site. If you would like a copy of this presentation or have further questions, please send an email to info@medicaresuppliersnetwork.com. A timeline for future updates to referral sources and the website are: as of September 2010, CMS will release the names of the Medicare contract suppliers. Please keep in mind this is not an exact date. It could be the very last of September or 1st of October. October 2010, CMS will begin education for patients and referral sources. January 1st of 2011, round 1 begins of competitive bidding in the 9 areas. January 1st of 2013, Round 2 of competitive bidding will begin, which will include 91 more competitive bid areas across the United States. For more information or questions and concerns, you can send an email to info@MedicareSuppliersNetwork.com. Thank you for joining us, and at this time I will be taking you to the website just to show you the presentation from today and what our site looks like. On the Home tab, you will have an overview of the Durable Medical Equipment Competitive Bidding Program, as well as the timeline is at the bottom. Our email for questions is also located on this page at info@MedicareSuppliersNetwork.com. The second tab are the product categories that are included in the program. Competitive bid areas, this will list the cities and list the counties, and at the bottom, if you click here, you will see a list of zip codes by competitive bid area. And finally, the tab 4 is the frequently asked questions that were included in today's presentation. Once again, thank you for joining us. This was brought to you by the Medicare Suppliers Network. If you have questions, you can email us at info@MedicareSuppliersNetwork.com or visit our website at www.MedicareSuppliersNetwork.com.